pocket, thank you.
Yes.
Okay, so now we have the beautiful Amy here. Just full disclosure, she also works for me. She's also a college student. She's a water polo player and a runner and an extreme enthusiast in hiking. She does a lot of hiking trips. So what's bothering you today?
Mostly my hip and my leg to my knee.
Okay. When she first got here, she did say that when she was running the last couple of days that she noticed she was tripping over the right foot. So now she's feeling some symptomology in this right hip. So we'll just take a look at it and we'll see, using kinesiology, where that leads us as far as how she needs to be treated today. So lay down on your back. Now I have worked on her for the past couple months also, but with her it's always been something a little bit different each time because she's so active. So this is actually a new injury that we really haven't looked at before. So let's see what we find. So first thing I'm going to do is I'm just going to come in and I'm going to stress test her low back because I know that she subluxates or comes out of alignment in a specific pattern in her low back, and that's present today. And then I'm going to stress some rotation into her pelvis, and I'm seeing that her pelvis is a little bit torqued. So these are a couple of things that we will treat. And let's come in and let's assess her primary mover in her anterior hip. That's her psoas muscle. It attaches in the lower spine and comes down and attaches to her upper femur bone, and this is the primary mover that allows us to lift her leg. So if she's having a problem tripping, it's possible that this leg's not lifting as high as she's thinking it is lifting. So let's isolate that muscle, and now Amy, push up into my hand here. Push up, and push up, and there it goes. That muscle just wants to fail. So we're seeing that she has a reflex inhibition over here on this side, which is telling us that that muscle is not firing at 100%. So since we're here, let's look at this TFL, which is her lateral stabilizer. Hold here. And one more time, let's hold, and that one just wants to give too. You can actually see her leg wavering as she's trying to recruit muscles to hold it in that position. Let's check the secondary mover for her hip flexion, and that would be the rectus quad muscle, or the quad rectus. And what this assists the psoas muscle in lifting the leg, so hold. And that one's about 90-95%, so I'm thinking most of her problem is here in the anterior hip girdle. So let's run through our little protocols here. So we're going to come up and we're going to touch up here. And we're going to isolate some of these vascular reflexes. Hold here. And nope, that's not it. Let's come in and touch these two spots right here and isolate our lymphatic reflexes. Push up into my hand. And no change there, so those aren't helping. So let's see, you did say that you had a couple of parties over the last couple of days. So I'm just going to go on a whim here and let's check a meridian point. So we're going to check the meridian for her kidneys because her kidneys are right next to the psoas muscles. So let's just put these arms down, not touch your body, and I'm going to isolate the tone point for her kidney meridian and push up into my hand, push up. That seems like that's a little bit better. Hold up. One more time. Okay, so once again, it's probably about 90-95%, but that's the reflex that's giving me the best indication that that might be where a problem exists. So besides adjusting her today, I'm going to use my cold laser and I'm going to treat the meridian for the kidney. I'm going to bring some energy into that kidney pathway and let's see how that impacts her. So let's slide down, and what we're going to do is we're going to adjust her low back. Now just from experience, I know that her low back comes anterior and to the right, and I'm going to try to be as accurate as I can, and I'm going to make my adjustments to try to put those vertebrae on center, because center line is the most important thing in any mechanical situation. We want everything to be centered. If the bones are on center, there's not going to be a lot of irritation that might interfere with the normal nerve signal. So we need to adjust this pelvis now. So what we're going to try to do is we're going to try to counter the torque in this pelvis. Okay, and just real quick here, I want to look at hip rotation. So her hip seems to be rotating evenly from side to side, so it's possible that the hip is not out of alignment. So now let's bring some energy into that kidney meridian, which we saw gave us a positive reflex sign. So this is similar to getting an acupuncture treatment. I'm not an acupuncturist, but I do use the meridian system sometimes. Once again, I'm using the cold laser. It's tuned to the healing frequency of the body. So we're administering energy that the body can absorb because it's identical. And the body will do with this energy what it feels like it needs to do. So I'm just going to once again do kind of a quick treatment here just to see if I can impact the reflex, which would be showing us that we're on the right path. And after this video clip, I'll probably spend some more time working on her and make sure that I've got her cleared out 100%. Okay, let's relax there. I'm just going to check one other aspect. This wouldn't necessarily be related with the psoas, but it could be related with the TFL, which is the lateral stabilizer. Okay, I was just checking to see if her knee was in alignment. Quick check tells me it probably is. Usually I check it a little bit more extensively, but we're on a time constraint. So let's come back and let's check the psoas muscle, and let's see if we elicited any change. So what we're looking for here is normal muscle tone all the way around this leg in 360 degrees. We have muscles on the top, the side, the back, the inside. All these muscles have to be in balance in order to have normal function. Any muscle that's out of balance, it could distort or pull that joint into a certain direction that might create irritation to the nervous system. And our objective is to clear all that irritation out. So any push up into my hand, and wow, okay, that's 100% reflex right there. This time I can actually feel you pushing up. Push. So she can actually elicit a little bit more strength because that initial reflex is there. So even though I'm applying pressure downwards, I can feel her push up, whereas before, just a few pounds of pressure on her leg was overwhelming her nervous system and it couldn't respond enough to counter that pressure. So this is good. This is telling me we're on the right track as far as how to adjust her a little bit more after we finish the sequence. So come on up. And this is just a stepping stone into what kinesiology is all about. It's a set of diagnostic and treatment protocols that help us work all of the systems related to a specific area of the body. And what we're trying to do is just restore normal reflex tone so that we have normal muscle tone and normal balance so that everything stays on center. So thank you for checking in, and we'll be back with another segment in just a minute.